I believe that our mental health is possibly the most important part of our life.
So our mental health is very, very important, and maybe it's something that we all neglect at times and don't pay too much attention to. We all have very, very busy lives and we all have pressures upon us. And we probably don't pay as much attention to our mental health as we should.
Anybody and everybody can be affected by issues around mental health. Mental health doesn't discriminate, I suppose, and anyone can face issues throughout their life. We all struggle at some point, but I suppose it's important to reach out for help.
Sometimes depend how we are internally feeling is how we're going to express our sexuality even.
When our mental health is low, everything is harder. And when our mental health is high, we have the resilience we need to do more. We can experience more. We can love more. Everything is easier. So our mental health is absolutely core to every single experience and memory we have in life.
I think any human being really can be affected, but if you think about the LGBTQI community, we are more prone for that because we've been oppressed for so long. So even like internalized homophobia, which is something that sometimes we don't even realize that we have.
So when we're thinking about who we kiss and how we kiss and where we kiss or whether we kiss, do we come away from that feeling good about ourselves? Are we empowered to go for what we want? Or do we shy away from the reality of our desire? In this, sexual health and mental health are absolutely connected. You can't have one without the other.
I think the big thing to me that I think we can do about our mental health is to start talking.
If you're struggling at the moment with your mental health, then just know that there is people always there to kind of help or to talk to.
What I would say to somebody who is struggling at the moment, who is maybe not feeling 100%, is, would you like to talk about it?
We should go to people that we trust, like friends, family, and really talk about how we are feeling. And I think that can be really powerful and beneficial.
There's many different services like the Gay Switchboard or LGBT Ireland that provide kind of services where you can phone or you can chat online.
People can also speak to their GP, who will be able to advise on mental health services in their area. Also, you know, there are services like the Samaritans who are there to listen to and support people if they are in a time of crisis.
What I can do for my mental health could be very different from what you could do for your mental health. I would ask you to ask yourself a question. What do I like? Do I get enough of it? Whatever it is, go get more.